Today, we're diving into a really important and honestly often misunderstood topic, eating disorders. We're going to cut through the noise and look at what's really going on from a clinical perspective, using established medical sources to get to the heart of these conditions. Let's get right into it. So, right off the bat, let's be crystal clear about something. This isn't about lifestyle choices or vanity. As our source material states, in no uncertain terms, eating disorders are incredibly serious, life-threatening conditions. The mortality rate is high. And a huge part of the danger is just how invisible they can be. These are severe mental health conditions, but they often thrive in secrecy. So the true number of people who are struggling, it's probably way higher than any official statistic can really show us. So to really get a handle on this, here's how we're going to break it down. We'll start with the hidden crisis itself. Then we'll take a close look at specific disorders like anorexia and bulimia, learn how to spot the warning signs, and then, most importantly, we'll talk about the path to recovery. Okay, so let's jump into our first section, understanding the fundamentals of this hidden health crisis. And this right here, this is probably the most important thing to get. Eating disorders are not just about food, they're complex mental illnesses, and they are deeply, deeply connected to other conditions. The source material actually draws a lot of parallels to anxiety disorders and points out how often they show up alongside depression or substance use issues. Understanding that connection is absolutely key.
All right, now let's zoom in on one of the most well-known disorders, anorexia nervosa. As you'll see, it's really defined by this powerful and difficult combination of restriction, intense fear, and a distorted perception of oneself.
So what does that mean clinically? Well, it really boils down to three distinct parts. First, there's restricting food and energy intake so much that it leads to a significantly low body weight. Second, there's this powerful, overwhelming fear of gaining weight. And third, there's a fundamental disconnect, a disturbance in how a person sees their own body versus reality. So how does this actually play out in someone's life? Well, it often starts with a preoccupation with food, maybe leading to very specific rituals around mealtimes. And what's interesting is that research shows it frequently begins during adolescence, a lot of times right after a major stressful event. It's also fascinating that one subtype is even linked to higher impulsivity, which kind of goes back to that idea of co-occurring conditions we just talked about. So clinically, anorexia is broken down into two main types. On the one hand, you have the restricting type, which is pretty much what it sounds like, severely limiting food intake. And then on the other hand, you have the binge eating/purging type, which involves cycles of binge eating or purging. Now let's explore two other major disorders, bulimia nervosa and binge eating disorder, which are really defined by these cycles of overconsumption. Bulimia nervosa is defined by this really powerful, destructive cycle. It starts with a binge, eating a large amount of food in a short time, often with a feeling of being completely out of control. And that binge is then followed by what's called a compensatory behavior, like purging, in an attempt to get rid of the calories. And here's a really critical point that makes bulimia so hard to spot. Unlike anorexia, most people with bulimia actually maintain a body weight that's in a normal or even slightly higher range. This means from the outside, it might look like nothing is wrong at all, which is why it's so often a deeply hidden struggle. Binge eating disorder shares that first part of the cycle with bulimia, those recurrent episodes of eating large amounts of food with a feeling of losing control. But, and this is the crucial difference, it's without the regular use of compensatory or purging behaviors that you see in bulimia. This table does a great job of laying out the key differences side by side. I mean, just look at that top row for body weight. It's a whole spectrum, from significantly low in anorexia to often overweight in binge eating disorder. And you can see how the presence of binging and those compensatory behaviors are really what sets each of these conditions apart. Okay, so now that we have the clinical definitions down, how can we actually recognize the warning signs? Let's talk about the common threads and risk factors that kind of cut across all of these diagnoses. So, on a behavior level, there are several red flags to be aware of. You might see a big shift in someone's eating habits, like they develop really rigid rituals around meals, or they start being secretive about what they're eating. Or maybe there's an obsessive focus on weight or on compulsive exercise. And of course, any sudden, unexplained changes in weight can be a major warning sign. And the research also points to several risk factors that can make a person more vulnerable. Things like a history of being a picky eater as a kid or a past history of obesity. And also being involved in activities where a certain body type is really prized, like in ballet or in the fashion and modeling worlds. And that brings us to our final and honestly our most important section, the path to recovery. This is where we really need to understand the true medical seriousness of these conditions and what healing actually looks like. Look, treatment is a complex thing, but it's vital to recognize when it becomes a flat-out medical emergency. When the body becomes severely malnourished, the physical complications can get so bad that acute, inpatient hospital care is required to literally save a person's life. For instance, one critical trigger for hospitalization is when the heart rate drops below 50 beats per minute. That's a sign that the heart is under extreme, dangerous strain. Another emergency signal is when body temperature falls below 36 degrees Celsius or 96.8 Fahrenheit. That's hypothermia, and it means the body's core systems are starting to shut down. And finally, a weight loss of more than 20% of a person's ideal body weight. Each of these isn't just a number. It's a threshold for immediate, life-saving medical help. It just drives home how physically dangerous these conditions really are. This also shows exactly why professional care is so critical. During recovery, there's a risk of this dangerous complication called refeeding syndrome. Basically, if nutrition is reintroduced too quickly to a body that's been starved, it can trigger a potentially fatal shock to the system. This is precisely why renourishment has to be managed so carefully by a medical team in a hospital. You know, understanding the clinical reality is such a critical first step. But it ultimately leaves us with a much bigger question, doesn't it? Knowing the severe risks and knowing the cultural pressures that can fuel these conditions, how can we as a society start to shift our focus away from just weight and toward genuine well-being? That's really the challenge for all of us to think about.